One of the contexts in which infections occur is through surgery. What's the most important thing for someone to ask their surgeon before going into surgery?
I think the most important thing that a patient can ask is, of the last 100 people or patients that did the procedure, like the one I'm going to have, what was your infection rate? You know, it's interesting. There's been a study out that has shown that when people are changing jobs, they spend about 10 hours researching. When they're going on a $1,000 vacation, they spend about 6 hours. And when we survey patients and we ask them, how much time do you spend looking into your surgeon? They said less than an hour. And right now, patients can actually go on the web for their particular department, a state department in their state, and they can look up their surgeon's name, their procedure, their hospital name, and find out what their infection rates are. So if you ask your surgeon this simple question and they get back to you and they say to you, don't worry, there's not a problem, then you need to find another surgeon. If they say to you, my infection rate is 3%, you can then take that information, look on the website, and find out if that's within the range. So if they give you a number, that's a positive thing, but you need to check out that number. Now, if you don't have a computer, because people will say, well, I'm elderly and I don't have a computer, you can go to your local library and ask them. They can look it up. Or you can just call your hospital and ask for the administrative building and department and ask them that rate. If they're not giving you this information, you seriously need to find another surgeon and another hospital.